All right. Let's begin, guys. Thank you all for being here. We have one bill. I'm going to call this meeting to order. We have one bill, resolution, I should say, on the agenda. Representative LaHood's H.R. 533. Yeah, he could have. Wherever you want, I'm sorry.
All right, thank you, Mr. Chairman and committee. Late hour in the day after a long day in session, and I can make this quick. This House resolution intends to create a study committee. This is a priority issue for the Georgia Council on Aging and the Georgia chapter of the Alzheimer's Association. And the issue we're trying to address here in the study and find solutions for is to our growing senior adult population. The demographics show that between years 2016, the population of seniors 65 and older in Georgia was 1.3 million. By 2040, that will be 2.9 million. That's a pretty big increase, and a lot of these cannot afford to take care of themselves when they need supportive services and when they cannot live independently at home. And currently, a lot of them are being referred to or funneled into some of the more costly settings. And so what we would seek to do with this study committee is look for more affordable, cost-conscious quality options for seniors. If anybody has any questions, I'll be glad to try to answer.
Do have a couple of questions here. Chairman Benton.
Thank you, Mr. Chairman. Representative Hood, could you give us some examples of some of these innovative financial options that we might be looking at? I might be interested in those in 20 or 30 years.
There's several, and they're listed. Some of them are listed in the bill. Just some examples, and again, this is a study committee where we will explore different ideas. We want to be innovative here, so bring new ideas to the table for discussion. But some that have been mentioned are, for example, there's a program called CCSP where a person who requires personal care could be eligible for a Medicaid waiver program to go into a personal care home, but it's restricted to licensed personal care homes of 24 beds and less. Assisted living communities with 25 or more beds are not eligible to participate in that program, which could be a very cost-effective program that would eliminate the necessity for some of these people to have to go to a skilled nursing setting, which is a lot more costly. That's just one example. I've got some people here that are in support of this bill that can give more ideas that have been discussed or that we would like to discuss. But again, it's a study committee that we want to come and brainstorm. There's no preconceived path here for us to go.
Okay. Thank you, Mr. Chairman.
Representative LaHood, if I could mention, just so when I and the language, of course, speaks to affordable, independent living with supportive services, and it could be, you just alluded to programs that might deal with licensed facilities like personal care homes or assisted living communities, but this could also be, I would be hopeful, independent living, and and we talk about affordability. One of the big challenges that I've noticed over the years is that a lot of folks that don't need to be in a facility per se, they do need affordable housing where they might have access to certain services. And so it could range from anything, I'm asking you, but to make sure I understand, from independent settings to skilled settings, really. I mean, all of those options are
Right.
necessary at certain points in people's lives, right?
And I've got lots of facts and stats here that can support the need for this, but basically, the more accessible we can make the supportive settings for these seniors, the better the chances we can keep them out of ERs repeatedly and out of the most costly environments. Another supportive talking point is that baby boomers had fewer children than the generation before them, and so there's a lot of senior orphans that will be created from that. Will not be as many adult children who are able or willing to take care of their aging parents, and so it's my feeling that this is going to become the state's responsibility in some capacity anyway, and so it's the responsible thing to do to get ahead of it as we can and look for innovative ways to keep this from becoming a crisis.
Okay. Representative Cannon.
Thank you, Mr. Chair. Just a few questions, Representative. Thank you for bringing the bill. I do think it's a very important topic. On line 12, you talk about the poverty level. I'm curious if this is the federal poverty level or a state-based determination. Where are you drawing this information from?
It's the federal poverty level
Okay.
per the Georgia Council on Aging, who helped me with the drafting of this.
Okay. Well, I think it would be more clear for it to say the federal poverty level, because the term poverty level is not generally recognized in our code without the term federal. A second question would be around line 16 with the census projections. I'm assuming you're talking about the 2020 census projections, and if so, where are those predicted numbers coming from?
Can you speak to that? Sure. Is that all right, Mr. Chairman?
Yes, Miss Floyd.
Thank you. I'm the Executive Director of the Georgia Council on Aging. It's from the census website, and so it would have been not from the 2010 census, but they do, in the interim years, some projections in just specific areas, and this came from one of those projections. I can give you for some reason 2016 is in my mind, but it's from one of the interim projections that they do in between, the 2010 and the 2020 census.
Okay. Well, thank you.
Certainly.
To the sponsor, I think it would be much more clear to include that information, because citations are important, if I may, for 2 follow-up questions. And then on line 21, you're talking about costly nursing home care. I'm curious as to what is costly nursing home care.
Well, skilled nursing home care in general is one of the most costly settings for a senior adult, to be in. I don't remember the exact reimbursement rate. Does anybody here?
The Medicaid state average is about 183 a day. The last I looked at it.
Right.
And some of the others on Council of Aging may be more.
The CCSP rate now is it 40 something, 50 something a day?
Per diem. Well, that would be for a different skill.
Different skill set.
Not
yes.
for skilled care.
Not for skilled.
But to that point, I think.
Right,
that
but
was
there's
the
some
last
argument
I
that
discovered.
people are being labeled as skilled prematurely sometimes because there's no other option for them, and so they're going to the more costly settings.
Okay. I find that to be really vague language. If you're talking specifically about skilled nursing home care, I think that should be outlined. If you're talking about assisted living care, it just seems very vague.
Well, it does say nursing home care, and that means skilled nursing. The terms are used interchangeably.
Thank you. And then on line 32, you cite the current wait list for non-Medicaid home and community services exceeds 7,000 older adults. Where is that wait list? Is that a DCH or a voucher wait list? Where is that wait list that you're?
I'd like to ask Ms. Floyd to answer that question too.
That wait list is kept at the Department of Human Services. We verify that figure every year, and it has been right at the 7,000 marks since September when we started tracking for this year. 7,000 people on the waiting list for those services across the state. And we have it on a per county basis also, which we've made available in appropriations.
Thank you.
And Ms. Floyd, that's more specifically with the Division of Aging under DHS, correct? And that is non-Medicaid, not to be confused with the Medicaid, with one of some of the waivers for aging, not to be confused with their wait list.
Exactly.
Thank you very much.
Thank you for the information at the appropriate time. I'd like to see if we can make some amendments to the legislation.
Okay, we have a question from Representative Bazemore. Oh, I'm sorry, Representative McLeod. Did I turn it off?
Okay, I got it now.
Okay, yeah, you got it.
Thank you, Chairman. I have two questions. On line 37, and I get that it reflects on District of Columbia, and I notice it's the Medicaid waivers. Is there any opportunity to expand Medicaid here for seniors in this case?
Is there any opportunity? Well, the committee would form to study all, variety of options.
Okay.
I can't say that it's my intent to expand Medicaid. My intent is to find the most affordable, cost-effective, and most quality, appropriate settings, for the senior in need.
I just want that to be part of the options if we're really trying to do as much as we can for seniors. The other thing that I didn't see anything here about an additional workforce. All of this is going to include more people working and getting the services that the seniors need. I think there should be some reflection or understanding that it's also going to need a workforce that is needed from health to just people maybe offering services to make sure that they get their things done, grocery shopping, all of that stuff. I think that's something that we should be looking at as well as to how much the manpower and do we have it here in the state of Georgia because of this growth.
You bring up a great point. Workforce is an issue. Chairman Petrie did do a study committee last year on workforce issues, and I'm sure we'll have the opportunity to use some of his findings in this study committee as well, if it does in fact pass. But thank you. Good points.
You're welcome.
Okay, any other questions of the committee? Okay, this is the appropriate time. Okay. We have a question, second, okay. Have a motion do pass and a second.
I think Representative Cannon had a couple of amendments you want to present.
Representative Cannon, we've got a motion on the, and a second. So now it's time for discussion. That's right. So, Representative Cannon.
I'd like to propose some amendments to House Resolution 533. The first would be on line 11, adding federal in front of poverty level, and repeating that on line 12 or 13, adding federal in front of poverty level. Additionally, on line 16, adding the year that was stated to by the executive director of 2016 in front of census projections. And on line 32, adding the Department of Human Services, Division of Aging Services in front of waitlist.
Okay, let's do this then. All right, so we're discussing this now. We have a motion and a second, now we're discussing. Some of these things, first of all, I do believe, as it relates to the 2016 census data, there was some interim data that Ms. Floyd mentioned. I don't know that you could concretely know that's expressly the year it came from. Am I correct? So I do not believe that should be added if we're not quite certain. I will say this, these resolutions are, the meat of the resolution is beginning on line 46. Everything prior to that is informative.
Mm-hmm.
What you're speaking to are some specifics to maybe make it more understandable.
Mm-hmm.
And we can have others weigh in, but I think in particular I would not put 2016 in. I think that I don't see any complete confidence coming from you there, and I think it is unnecessary on line 32. There is a non-Medicaid home and community services waiting list. Where it's located, I don't find that to be relevant, quite frankly. The issue of federal poverty level, I'm glad to hear from others on the committee if you think that's important. It is customary in aging services that the poverty level is typically the federal poverty level. It is that which we refer to on a regular basis. Okay, number 5, that would be Ms. McLeod.
Yes, thank you, Chairman. I'd like to get some amendments myself. I would like to see some other option for her supportive assistance include a Medicaid expansion option. And I would also, I know you mentioned that Chairman Petraeus had some data on workforce numbers. I would like to make sure that that is covered in this resolution, to make sure that we address this, because it's going to be, you can't be building stuff and then not have the support for the seniors that they'll need.
Okay, again, we're having conversation, but I will speak to that by first saying this. So the results of that study committee, I appreciate very much that you're interested. I want you to I'll make sure you get a copy of that. Actually, Tara, can you make sure? In fact, I'd like everyone here to have a copy of that. And we're real proud of those results, and there's a lot in there we're going to work on going forward. I don't know. The author can speak to his concern about that being, we've just had a study committee on that last year. And then the issue of Medicaid expansion, I think, really gets us off course with what you're trying to do here. But again, I'll let you respond to that. And then we have a question from Ms. Wynn as well.
Yeah, I
Representative
do
Hood.
appreciate you bringing those points up. Very valid points. You know, as someone who I'm assuming would be a part of this study committee, hopefully steering a lot of the conversations and agenda topics, then I want to assure you that we will, in fact, include the findings from the workforce study committee that happened last year, and all options will be looked at. I want to be, you know, I want this to be a very responsible approach to finding solutions for seniors. Seniors have a very special place in my heart. I've worked with seniors my entire life, and I've seen families who can afford the very best, and I've seen those that can't afford anything. That's right, and there's all, you know, types in between. And like I said earlier, I feel like it's the responsible thing to do to study this issue and make sure we look at all options that are, you know, responsible and you know, in the spirit of being good stewards towards our seniors and fiscally responsible with the taxpayers' money.
Okay. Representative Wynn.
Thank you, Mr. Chair. I did want to just offer some support on the amendment suggested by Representative Cannon, especially when it comes to clarification with just the way that the bill is written in general. With the federal poverty line and just putting the term federal, I don't see how it would hurt the bill, take away from it, but would actually just add some clarification so that there is no confusion. So I want to offer some support on that specific amendment as offered by Representative Cannon, as well as line 32 to clarify the actual current wait list. I do think that the more specific we are, the better it would be. And then I do have one additional question or recommendation. If we could have some language that would specify that this would be a bipartisan committee, because it is a bipartisan issue, would there be opportunity for us to entertain in lines 49 that there would be at least one member of the minority party appointed to that committee?
That is typically not in a resolution. I will,
Sure.
but Representative, but in every study committee I have ever seen, they are bipartisan.
Thank you,
I
Mr.
have
Chair.
not seen one that was not. Tara, as well? Okay.
Thank you, Mr. Chair.
Thank you, Representative Wynn. Okay, so we just heard a great deal of conversation about some potential amendments. Meanwhile, we have a motion and a second before us. And amendments on the floor. So I got to make sure I do this the right way. So what? So, but we'll just take them one at a time. Let's just take them one at a time. All right. Let's just trying to make sure I keep them in order here. So we'll go to Representative Cannon first. Okay. Let me just keep this straight. And Representative Cannon, give us your amendments so that we can have, Vince, can you hear clearly? Okay. Okay.
The first amendment is to amend line 12 to add the word federal in front of the word poverty. And the second amendment, to be consistent, is on line 13 to add federal in front of the word poverty. The third amendment is on line 32 to add Department of Human Services in front of wait. That's all.
Department of Human Services. Okay, right here. Yeah. Okay. Vince, do you have that? Yes. Okay, you want to read those back to us to make sure we're all clear real quickly?
Sure. The first amendment would be word federal in front of the word poverty on line 12. The second amendment would be the word federal in front of the word poverty on line 13. And the third amendment would be the words Department of Human Services on line 32 after the word current, before the word wait.
That is my understanding. Is that yours? Is that good, Representative Cannon? Is that consistent with what you just described?
DHS after current, is that what you said? Okay.
Yes.
Yes.
Her amendment is probably adequate. I think I was just speaking earlier to the division that is under the department. I don't think that's necessary. Okay, so we're good. All right. So we have Representative Cannon's amendment with those three changes. Okay. All in favor?
Aye.
All opposed? Okay. Passes. I can't hear you. Yeah. I got you. Okay. I just wanted to make sure we didn't have. So now, at the appropriate time is now.
Motion do pass with amendment. as amended.
Okay. Okay, all in favor?
Aye.
Any opposed? Okay, very good. Thank you, Representative LaHood.
Thank you.
Thank you, sir.
Thanks, committee.
We are adjourned. You gotta keep me straight here.